Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
The next differential diagnosis of a fibroid is adenomyosis.
Adenomyosis. In adenomyosis is seen more than or equal to 45 years of age. Here the patient presents with excessive bleeding and dysmenorrhea. 10% of the cases show dyspareunia also. On per vaginal examination, there is enlarged uterus up to 10 to 12 weeks of gestation. There is symmetrical enlargement of uterus or globular uterus. The uterus is tender. So this tender uterus is called as Halpern sign. First investigation is transvaginal ultrasonography and investigation of choice shows MRI. Investigation of choice is MRI. Cross examination. Cross examination depends on the origin, like endometrium within the myometrium, that is globular appearance. Earlier adenomyosis is called as endometriosis interna.
thank you and thank you for watching.